And now joining us via Skype to discuss the newest Israeli quarantine and isolation directives, we have the head of international relations with the Israeli Ministry of Health, Dr. Salmon. Thank you so much for joining us. Now, can you one more time, really quickly, outline the latest health ministry guidelines?
Good afternoon. So as you all know, yesterday evening the government had published a set of new orders, and we are working now to process them and to publish a detailed set of instruction how to behave. In general, what we are doing is a social dissociation, not in order to shut down the country, but rather to diminish as much as possible contacts, in the sense that people will be infected by the virus. Now, it includes asking people not to gather in groups of above 10 people, to diminish public transportation services, and when you use public transportation, to not to allow people to squeeze into buses.
To be seated 2 meters apart from everybody and away from the driver. Yeah?
As well. But even there, I think we're limited to 20 or 30 people a bus.
Wow.
And we are trying to convince most employers to employ as many as their employees at home and ask them to work from home. We at the same time have crucial services running all over the country, and people that are involved in crucial services must continue on appearing to work, and we are looking for solutions for children. As much as talking about young children, we did close all education, the whole education system, including kindergarten, nurseries, primary school, etc. That is a big burden for the whole of the country, but it's necessary.
All right, well, so what are some of the best ways for the elderly and people with chronic illnesses, you know, those who are most at risk of from the coronavirus, to look after themselves? Should they enter isolation preemptively as a precaution, and if so, for how long?
So it's not isolation, but we did mention, and that was already last week, that people above the age of 60 and people with underlying medical conditions should consider diminishing even further the contacts, meaning don't really leave home unless you must go to, to the clinic or to get food product or so. Avoid gathering, avoid exposures. We are asking people not to visit parents' houses and hospitals for unnecessary visits. The basic idea is that these people, when they do catch the virus, they have a much higher chance of developing a serious form of the disease, and the risk of dying from it is higher than the rest of the population.
So right now, the number of coronavirus patients in Israel has hit 200. Is this a real number, do you believe, or is this just the most updated number that we have officially? How much more patients, how many more patients do you think that we'll have, and how soon?
We don't know. We believe that we have some more patients in the community which were not diagnosed yet, due to the fact that maybe they are asymptomatic, or rather they did not approach our services. We can still say that almost all of our positive cases we could trace down exactly whether they came from abroad with a virus or whether they had a contact with a positive patient. We have only 2 or 3 cases where this link is not established, meaning that we may have coronavirus out in the community, but still not in huge numbers.
All right, and so my final question, unfortunately we're running out of time, but what happens if there is a full shutdown? How might that look like, and is that on the horizon?
I hope we would not get to a full shutdown. This country must continue on functioning, and we have crucial services that must continue on functioning. We may tighten a bit the rules and make the current shutdown to be even more tough, but I don't think we'll get a total closure. And we have to understand it's not a week or 2. It's quite a long process, but we do hope when the spring will come in and the infectious curve would be flattened down, we would see an improvement. And when we have an improvement, when we'll have more recovered cases and new infections.
All right. Dr. Salmon, thank you so much for joining us.